Presenting a case of failed back surgery syndrome. Failed back surgery syndrome occurs when, following surgery, there is more pain than what was experienced by the patient before surgery. This is quite common in spinal surgery. It can be as high as 20 or even as high as 40% following spinal surgical intervention. The following story is a true story, and the patient has consented for the release of this video. However, a professional actor will play the role of the patient in this video to protect the patient's identity.
Hello, Mrs. Chadwick. So tell me a little bit more about yourself. What I understand you've come with severe back pain. So just tell us a little bit about your history, Mrs. Chadwick.
Well, my job was a nurse practitioner. I was doing really well and life was good. I was getting some back pain and I was advised to have a surgery, which was symphysis pubis at the front, which was a fusion, I think in August 2014. I was able to go back to work afterwards for about 8 or 9 months until I had more pain. And unfortunately, the pain then became more unbearable, so I couldn't work anymore. And then I was advised to have another surgery. So I had a 360-degree fusion in August 2015. Again, I went back to work and I had more pain. And then I had a third surgery, which I think, if I'm right, was a bilateral sacroiliac joint fusion. And that was in 2017. The problem is, I was actually all right for a while. After about a year or two of recovery, I was actually okay for a short while. I could go out and walk the dog, and I thought that maybe this was a bit of freedom for myself. And then I've just been in, for about the last year and a half, I've been in terrible pain again. And I've been using a wheelchair, which has become more and more regular to the point now where if I go out, I have to be in a wheelchair all the time. I have 2 sons, 15 and 21, and them and my husband, thank goodness I have a support network around me. They are very helpful. My husband has to do all the shopping, a lot of the cleaning and cooking. And yeah, it's a shame. My life obviously is not what it used to be. And I'm in absolute agony all the time. I am on a lot of medication too.
Right. I'm sorry to hear all that. I have had an opportunity to look at your x-rays and scans, and we'll go through the x-rays and scans and I'll explain things to you. I don't think another surgery is going to help you. I mean, I feel maybe even the first surgery might not have been required, but it is difficult. Sometimes patients having back pain, they have surgery, but still the pain lasts, and it can be quite high. It could be up to 1 in 5 people have that, after surgery. Sometimes sometimes it's more than 1 in 5. They say up to 1 in 2 or 1 in 3 can have severe pain. That is the unpredictability of spinal surgery, and I'm sorry you're suffering like this. And that is called failed back surgery syndrome. And I know you can't remember all the surgeries, but I will take you through all. I mean, I have had an opportunity to view all your x-rays and scans, at least some of which I've seen, and I'll take you through those. And I'll explain what I think happened at each spot. And I think everyone has done the best that they can, but now I don't think any further surgery is possible. And unfortunately, we can't wind the clock back. It would be good. And it's sad, many times we take on things and we can pass it on. Even if I buy a house and I don't like it, I can reduce the price and sell it on. Or a car, I can sell it off, or something. But surgery is not something we can pass it on. So, I'm sorry that you are in this agony and you have to take a lot of medication. But at least if you understand what has happened, then maybe, it will be easier for you to cope with the pain, because I think we have come to a stage where you have to just learn to cope with the pain. I know you're on a wheelchair now but at home you can manage holding on to furniture, but otherwise when you go outside, you're on a wheelchair. So let me show you the scans and x-rays that we had so we can, look through them. And please feel free to ask any questions as we go through them. Yeah. Is it okay, Mrs. Chadwick?
Yes, that's fine. Thank you.
So from what I can see, this was the first x-ray of your pelvis that you had. This was done sometime in 2014. And this shows this is the ring of the pelvis. These are your two thigh bones or the femur. And this is the head of the femur on either side. This is your left and this is your right. This is your ring of your pelvis. And this is the pubic symphysis or the joint in the front of the pelvis. And there are two joints. This is the lower part of the spine, and the lowest part of the spine is a fused segment. It's a triangular piece of bone called the sacrum, and the sacrum wedges into the ring of the pelvis. And on either side where the sacrum meets the pelvis is the sacroiliac joint. So this is the right sacroiliac joint and is the left sacroiliac joint. So this is how your pelvis was before you had any surgery. And so this was an X-ray taken about 6 years ago. At that same time, you also had an MRI scan. You have a small amount of scoliosis or curvature in your spine. That is why we can't see everything. There are two images. I can't show you all the images, but I can show you some of the images. Here is what is known as a sagittal, or the cuts from top to bottom, but front to back. So it is a lengthwise cut. So your tummy is here. This is where your back is. And this is sort of right in the center. And these are the blocks of bones that make up the vertebral column. And in between the blocks of bones are the cushions or the intervertebral discs. Behind each block of bone is a ring of bone. All the rings put together form a tunnel, and it's through this tunnel that the spinal cord and the nerves come through. Now you can see this cushion is light gray in color. These two cushions are dark in color. So being dark, they have lost its water supply or the amount of water it contains. So on this particular scan, which is called a T2 weighted scan, water is white in color, fluid is white in color. So the cerebrospinal fluid is white in color, and this disc, which has a reasonable amount of water, is white in color or light gray. But these two discs are black in color, and they are dehydrated or degenerate discs. But when we say degenerate, it must understand it is only age-related changes and not more than age-related changes. And I'm not wishing to be rude to you, but your skin is not baby skin. Same way your skin shows your age, same way your spine has to show your age. I mean, it cannot be that your spine looks like a baby spine. It will only show your age. So this is age commensurate changes at that stage. But then what happened? So that was the MRI scan 6 years ago. This was the first surgery that you had. About 5.5 to 6 years ago, you had the surgery. They put a spring into your left sacroiliac joint and fused your left sacroiliac joint. And they also put a plate in front of your symphysis pubis and fused your symphysis pubis. So you had a fusion in the back through your sacroiliac joint and a fusion in the front through your symphysis pubis. And I understand you worked for about 6 to 8 months after that. You were off work for about 2-3 months after the surgery for rehabilitation. Then you returned back to work and you worked. And then I presume after 6 to 8 months, again, you had problems and you sought the same medical advice and you're offered further surgery. So at that point, so these were the first surgery that you had. At that point, again, further surgery was done. Again, this is a 360-degree fusion. When I say 360 degrees, it is fusion from the front and fusion from the back. So from the back, you had a cut in your back and they put 2 rods and 6 screws into your vertebrae. So these 2 screws go into your L4 vertebrae, these 2 screws into your L5 vertebrae, and the last 2 screws into your S1 vertebrae. So from the back is the scaffolding of these rods and the screws. But they've also gone in through your tummy, moved your intestines to the side, and gone into the disc. So these were the disc above. So this is the L3-4 disc. We can see is a normal space where the intervertebral disc is present. But here they have taken off the disc and put a cage with fusion, and you can see the radio opaque markers in the cage. That is these white marks that you can see. So they have, because it is 360 front and back, that's why it's called a 360 fusion, and the previous fusion to your SI joint has remained. Then understand, after this you were off work rehabilitating for a few months, and I understand that this is when your tribunal was, and you won the tribunal, and you were, you had to stop working after the second operation, but still you had further pain, and that further pain resulted in this further operation, whereby, so this was your first operation, this was your second operation. Both your sacroiliac joints were fused with implants. You can see this is your right sacroiliac joint was fused, and the left. Again, a double operation, one on each side. So that was 3 years ago. And at that point, you had stopped working and you were sent out. You were a nurse practitioner. And now this is your situation. This is the X-ray that is seen now. So your first operation was a double operation with the spring-like fusion into your left sacroiliac joint and your symphysis pubis. Your second operation was the scaffolding through the back, the pedicle rod and screws, and the cages in the front. Again, a double, one from the back, one from the front. And the third was a double, one on the right, 3 implants on the right sacroiliac joint, and again 3 implants. I know it looks only 2, but there are 3 implants. One is here, and there is one, and one is lying behind. There is a small.
Yeah, I see.
Yeah, there are 3 implants there. So again, so you have had 3 double operations or nearly 6 surgeries to your spine. Now, I suspect what you have now is called Failback surgery syndrome. Unfortunately, this is very commonplace, and many patients have not been told. And unfortunately, patients, even before surgery, are not warned of this complication. If they are warned, maybe less people may undertake surgery, but they are not warned. Even a single surgery can cause this. And obviously, if you have 2 or 3 surgeries, the chance of developing Failback surgery syndrome just increases. So this is an article published in 2016 in the Journal of Pain Research. And this shows the extent of Failback surgery syndrome. It says patients with Failback have had chronic, long-standing back pain with or without referred or radicular symptoms. Referred means pain referred to any other part of the lower back, or radicular meaning going down the leg, and has had 1 or more surgical interventions that have failed to treat the pain. Unfortunately, this happens all too often, with conservative estimates at 20%, but other estimates as high as 40%. So maybe 1 out of 5 or 4 out of 10, 2 out of 10 or 4 out of 10 can have potentially Failback surgery syndrome. So it's quite high. And sometimes patients fail to gather that this could be the potential problem. And, if maybe they were made aware, it might not have been. This is another article by Simon Thompson, and again a peer-reviewed article in the British Journal of Pain, and again talks about Failback syndrome. And the definition is persistent or recurrent pain in the back, neck, or limbs despite surgery or treatment thought likely to relieve pain. So you've had surgery and it is still not better, and you're still left with more pain than what you were there before. And surprisingly, that same article discusses the 4 common, very painful conditions. CRPS is complex regional pain syndrome, rheumatoid arthritis, osteoarthritis, and fibromyalgia. They have compared 4 of these conditions, and they have shown that treating a patient with Failback surgery syndrome cost 1,802 euros per year, compared with all the others were less costlier. So much of the tablets and the medications needed to treat Failback surgery syndrome. And that is what has happened in you. And unfortunately, there is I wish there was a surgical option available. The surgical option is not available. And you are in so much more pain. And I'm sorry this has happened to you. Does that give you some idea on...
Yeah, I mean, I understand. It just makes me really sad that maybe it was avoidable, but I'll never know. It's just, yeah, difficult to hear that.
I know. Initially, when they have pain, people are so vulnerable. They want the quickest fix for it. But unfortunately, there is no quick fix for back pain. And when in that hope for the quick fix, they choose these options, and then they have more pain following surgery than what they had before. And it is the chance of it occurring is quite a lot. Can you just tell me the medications you're on, Mrs. Chadwick?
Yeah, there's quite a lot, so it's a lot to remember. Okay, so I know I take 3 times a day pregabalin. I think that's how you say it. Yeah, Zormorph, 10 milligrams twice a day.
And pregabalin, you're on 200 milligrams.
200 milligrams 3 times a day, yeah.
Right, that's quite a lot. That is your total taking about 600 milligrams of pregabalin.
Oramorph.
Yeah.
Yeah, if I need it, every 3 to 4 hours, 5 to 10 mils. I also have diclofenac suppositories and diazepam when I get really, really painful, when it's unbearable.
I'm sorry. I know that is quite a lot of medication, and I don't think any further medication also will cure the problem, and they are only suppressing the pain or masking the pain. They're not really curing the pain. And the difficulty is when you have failback surgery syndrome, it is like this. You must understand nerves are like a fire alarm if you were to consider a fire alarm situation. So if there is a fire, the fire alarm goes off, there is danger and you can react. Same way, if there is, say, I put my finger into a flame, there is pain, I take my finger off. So it's like a fire alarm system. But sometimes the problem may be with the fire alarm. We see a lot of other issues. Like, let me give you a metaphor. I know it is a bizarre metaphor. In my house, my fire alarm went off. Now, I didn't know why it was going off. And someone told me my kettle was bad. So I went and changed my kettle. But still again, my fire alarm went off. Then someone told me, well, it is your toaster that is bad, is causing the fire. I went and changed my toaster, but still my fire alarm is going off. Then I went and changed my cooker. Then I went and changed my boiler. I went on spending a lot of money, but still the fire alarm is going off without realizing the problem was in the fire alarm. So it is possible that the original problem was in the nerves, and none of the operation addresses the nerves at all. It is addressing the other issues which you're accidentally finding as you investigate. Sometimes MRI scans will highlight things which are completely normal. And that is, they are all oversensitive. It's like, I have brushed my teeth this morning. I'm sure you have brushed your teeth this morning. But if I take a microscope and look into our mouths, there is going to be millions of bacteria there. That is just natural. They have to live with us. They are part of us. Yes, tomorrow morning or this evening when we brush our teeth, those bacteria are going to go. But during the day, there will still be bacteria, and that is part of us. Imagining that there is bacteria, and if I keep brushing my teeth every half an hour, I'll actually be damaging my teeth rather than making it any better. And that is exactly what happens. I am sorry about what you have to go through. We can go through some set of exercises and rehab program, and you may require some psychological help to cope with it. And I understand, and it's very good that your family is supporting you and you're able to, tolerate this better. Yeah. Any other questions, Mrs. Chadwick?
No real questions, but I will, if you've got exercises that may help, I would like to do them.
Yeah. The only potential is that, the message is that even others who are thinking of spinal surgery should understand the possibility of failback surgery syndrome and, consider that as a potential complication, and don't want to result in the, the type of difficulty that you are facing at the moment.
Yeah, I wouldn't want anyone to have to go through what I've gone through.
Yeah. Good. Okay. Thank you, Mrs. Chadwick. I hope we've been able to explain things. And I will get you some exercise and we'll take it from there. Yeah. And maybe through your GP, you can try to get some psychological services or pain management services. Yeah.
Yeah. Thank you.
Thank you very much, Mrs. Chadwick. Yeah. Bye-bye.
Thank you for watching our video. Please subscribe to our channel. If you need further information, please visit one of the following websites: easethespine.com, ampat.co.uk, and freefrompain.org.uk.